Hi, I'm Dr. Godis, and we produced this video on crystal methamphetamine and why it's a bad thing to do. It's for students and teachers. It's in 3 sections. The first section you'll have to advance to using your forward button. That's for students and it's in English. The second section is also for students, but it's in Spanish. Hit the forward button twice to get there. The third section is for teachers. Yes, you've got it. Hit the forward button 3 times and that's where you'll be. I hope you enjoy it. Sit back, relax, watch, and learn all about this drug. Have a good day.
My name is Kathleen Kennedy. I went to Union Mine High School. I was a meth addict and alcohol abuser, and I used pretty much anything I could find for 3 years. I've been clean for 3.5.
So tell me, when did you start using amphetamines?
When I was 15.
You were 15, so you were in high school.
Yeah.
How many people do you think at the school at that time were using crystal meth?
About 5 or 6 that I knew of.
That you knew of, that were your personal friends?
Yeah.
Okay. So have you noticed any effects on your teeth since you've been using crystal meth?
Yeah, they break easier. So.
Why are you here today?
Because I got broken teeth.
Why don't you show me what you came in holding today? I notice you keep putting your hand over there. Why don't you show me here how you walked into the office today?
It's my heat pack.
Why are you using that heat pack?
Because my wisdom tooth is broken.
Uh-huh. And how do you think that happened?
From using meth.
You think so?
Yeah.
All right, Kathleen, these are your x-rays, and what we're going to see up here is, this is tooth number 1, and it's pretty badly decayed, and that's the wisdom tooth we're going to take out. And here's tooth number 2, and that's also pretty badly decayed, and that's probably going to need a root canal more than likely. And if you look over on the other side, we don't have a full set of x-rays here, but if you look over, now here's a root canal that was done.
Yeah.
And it's pretty unusual to have to do a root canal on such a young girl, and you would think that somebody would ask a question as to why you're having all these problems. And here's tooth number 16, which is also very badly decayed. It's taken a lot of years for it to get that bad. We're going to take that out too. And then if you look down on the bottom here, which is another important thing, you have a large cavity between tooth number 18, your second molar, and tooth number 19. Okay, and then if you look over on the right side, tooth number 30 also has a large cavity. That's your lower right first molar. And you can see you had a really large cavity on tooth number 31, which now has a filling. And there's 32, which is going to go bye-bye soon. So you can see that you have some problems just on these 4 x-rays. And we don't have the whole set right now, but just on these 4 x-rays, there's a lot of problems that need to be addressed. So we're going to get you back in the room and take care of 4 of those problems right now, okay? All right, now, what you're going to see here is this is the first molar, here's the second molar, here's the third molar. The third molar is really gone. It's really not much left of it. The second molar, you can see what crystal meth helped do, which is basically it ate away all of the outside part of the tooth near the gum line, okay? You see that? Mm-hmm.
She wonders why the birds fly by and don't stop in for tea. She wonders why the ghost on the side of the bed shakes his head at me. You know she lives the best she can, but she knows she dies a little more every day. I hate the game she plays like your mother-in-law, but I just can't help but play them. She comes to me and cries. I tell her real lies. You can't find love if love was never there. You can't find love if love was never there. She wants to be a superhero for everyone to see. She wants to do something amazing for everyone but me. You know she lives every day, but she dies a little more every night. I hate the game she plays like your mother-in-law, but I just can't help but fight them. She comes to me and cries. I tell her gonna realize you can't find love if love was never there. You can't find love if love was never there. She says that everyone who's loved her has eventually stopped. She says that everyone who sees her for what she's not. Tell her think about tomorrow, forget about yesterday. I know she don't listen to me when I say
One of the biggest challenges facing El Dorado County and many other counties like ours is the widespread use and abundance of crystal meth and crank. Hi, my name is Jamie Goodis. I graduated Ponderosa High School in 1998 and now attend George Washington University School of Medicine. I have been working in my dad's dental clinic and have gotten to see firsthand the ravages that crystal meth has wrought upon the bodies as well as the teeth of many of my peers. This is a very sad and frustrating thing. There's got to be something we can do about it. So many of these patients have come into the dental clinic that we began filming them. All of them are devastated that as a consequence of their drug use, they will lose the majority of their teeth before the age of 30. They all want you to know one thing. It's not worth it. It's not worth it to lose your teeth, and it's not worth it to have dentures by the age of 28. And most of all, it's just not worth it to do the drugs. It hurts me to see so many of my previous classmates in here having their teeth pulled out because of drug use. So if you don't get anything else from this, get this. It's not worth it. Don't do drugs.
Hi, my name's Justin, and well, this is what happens when you use crystal meth.
Where'd you go to high school?
You need mine.
How's it going? I'm a former meth user for 7 years.
Where did you go to high school?
I went to El Dorado High School in Independence.
Did you graduate?
No, I haven't yet. I'm currently an adult ed.
What grade did you start using drugs?
7th grade.
7th grade?
Yeah.
What high school did you go to?
I went to Union Mine and I went to Juvenile Hall High School.
My teeth, I have really bad teeth from using crystal meth and methamphetamines for the last 16 years. I'm 32 years old now. I can't go out in public and smile and feel confident about my smile.
Where'd you go to high school?
I went to high school at El Dorado High, Ponderosa, Independence. The drug it's no good for you. It lowers your self-esteem. It lowers your capabilities of what you can and what you think you can't do. You can't do everything you want. But to not have good teeth and to use and not have good teeth, it just really hurts to go out and to get a job. It's hard to get a job. To feel at a public function and to smile and to be around in-laws. You never know who you're going to meet as you grow up.
Why aren't we showing your face on this?
I don't know.
Because
the reason why I don't want my face shown is because it's really hard to, once you are labeled as a user and people can see your teeth, they know you're a user. And I don't want my face to be shown because I've changed my life. I've quit and I've been clean for a year and a half now, and I'm here at the dentist's office trying to get my teeth fixed because I have low self-esteem. I can't smile. All those things. I'm here to get my teeth fixed for something.
Well, let's take a look here. I just want to show some. Let's see what's going on here now. Look over here, and this is what you see on your typical crystal meth user. You see large carious lesions on the outside surfaces of the teeth, especially down by the gum line here. Okay, turn this way and toward me a little bit more. Come on over this way. And here it is on the other side too. So when we see this smile, what we see is a large expanse of lack of tooth structure here. And you can see it starting on the teeth in the back too. And when you smile, how does that impress somebody who you're applying for a job with?
It doesn't. I don't even really have to smile. They can see my teeth and they automatically label me as a user. And it's really hard, especially when you decide to quit, and hopefully you guys will never start. But if you do, hopefully you decide to quit before it's too late.
Hi, my name is Jennifer Silva. I am currently in Union Mine High School.
Hi, I'm Kat Kennedy. I dropped out of Union Mine High School.
Hi, I'm Vince Boss. I work full-time.
Where'd you go to high school?
I went to high school at Charter Community School.
And before you were there, where'd you go?
I went to El Dorado High School, but I got kicked out for being bad.
I'm Sharon Stone. I just have tooth pulled. I went to Union Mine until I got kicked out.
Okay. And what do you think was one of the main reasons that you three, not you, you're not in trouble for anything, so keep it that way. What do you think was the main reason that you folks got kicked out of school?
Drugs.
Drugs, yeah.
Drugs.
Drugs and drinking.
Fighting.
Drinking at a young age, so that probably wasn't a good idea.
What drugs were you using?
Well, everything I could get my hands on when I was younger, pretty much.
Were you able to buy them in school?
Oh, yeah.
What did you do when you were in school?
I usually didn't do them at school. I usually ditched school to do them, which really got me in that got me in the most trouble. It's not going to school, so.
I just did it behind the library.
I'm in the counselor's office.
Yeah,
I was too scared to do all that.
same spot at Union Mine, so.
A lot of people say that, there's not drugs in school, but they're not aware that there is. There was problems for my mom when she was in high school, drug problems for me in high school. There's problems for the kids now in high school. It's all out there and it's horrible. There's too much.
I think kids start drugs for boredom, attention, to fit in, all that, and that's just not right. I started because of depression, and I didn't have anyone to talk to, so maybe if you talk to your kids, they'll stop too.
A survey in the El Dorado County School District shows that 1% of 9th graders and 1% of 11th graders have used methamphetamine within the last 30 days.
If you count Ponderosa, El Dorado, Oak Ridge, and Union Mine, that comes out to about 75 kids.
Like that.
Don't think that these kids are doing it by themselves. They're sharing and they're telling their friends that this is the drug to be taking, and that's wrong.
It's really sad to think that some of these people are trying to influence my friends and even me to do drugs, and that makes me really sad.
I'm Shannon Stone. I went to Union Mine High School, and I started using methamphetamines as a freshman. I believe I was 14 years old. I'm now 20, almost 21. I've been clean for about 4 years now, and the immediate, or how would I put that, although you don't think drugs might not affect you, it might not do it immediately to your body on the outside, but it immediately affected my teeth. I might not have taken the best care of them, but that did not help it at all. It made it a lot worse. I really don't know.
Why are you here today?
I'm here because of how bad my teeth are. I've had a lot of pain. The two days now, my face has gotten swollen. I've had to go to the emergency room for 3 times this month alone because of one tooth that's just falling apart. All my teeth pretty much are falling apart on me. They have no more structure. All the enamel's disappearing on them. And it's really hard because you need those to eat every day, It's really painful, and I don't like waking up in the middle of the night dealing with all this pain. And it all, again, goes back to the drugs that I experimented with.
Well, guess what?
What?
We're going to take your tooth out.
That's good. Now get it out. Because it hurts.
All right, let's get going. Let me look at your x-ray for just a minute, okay? And we'll talk about this.
Okay.
Okay, so if you look over here, Shannon, okay, you'll see that the big problem you have on this tooth is you have an abscess resulting from really deep cavities, and started a root canal some time ago. Since then, it's been swelling up and swelling up and swelling up, and now it's been a while, and this tooth's pretty hollowed out, so we're going to take that one out for you.
Okay.
Okay, and you can see there's not a whole lot left of the internal structure of the tooth. It's pretty much nothing more than a shell anymore. Okay, but I want to point out something else on your x-rays. You see down the bottom, you've already lost the bicuspid, and of course our goal is that we don't want you to lose any more teeth if we can avoid that. Okay, and what you can't see on the x-rays here is that you have several teeth that have areas with cervical decay. which is something that's almost pathognomonic or very commonly seen in people that were using amphetamines. So we're going to take a look inside your mouth in a little bit and try and fix one tooth, and we're also going to take that other one out for you today. And what you can see here is on the second molar, she's got cervical decay, which is really attacking the tooth. And if we look down toward the bottom, open up just a little bit and turn toward me. That's it. She's got cavities on her lower first molar and on the biting surface and the facial surface of her lower second molar. Cavities on the upper left side got so bad that she ended up needing a root canal, and that's the tooth that is in pretty bad shape today. We're going to be pulling that out later. But additionally, we have cavities down here on the lower left side on her first and second molar, and on the upper, and this is the tooth we're going to be taking out later. This is that root canal that's not doing so well. I want this to be the last tooth that you lose ever.
Don't do drugs, it hurts.
Alright, hi, my name is Jerry Kate Harrington. I graduated from El Dorado High School in 1999. I'm going to be going to Loma Linda Dental School in a couple weeks, which will be September 2003. And I've been in the dental field for the last 4 years, and I've seen a lot of dental decay as a result of crystal meth and various other drugs. It's important to brush and floss your teeth daily and avoid any kind of drugs that will damage your teeth. Otherwise, they will end up like these teeth in this jar. Very beautiful.
Which drugs did you use?
Methamphetamines, crystal, crank. I just found out I have 17 cavities and 2 root canals.
How do you feel about that?
It's kind of crappy, actually.
No one ever told me it would ruin my teeth. So no one ever told me that I'd be 5 foot tall, 85 pounds at 19 years old either. I just figured it was something you do. My friends' parents were doing it and so were my friends, so I did.
But it's on campus.
Oh, it's definitely on campus. That's where I actually started. The first time I ever did meth was I did a line in the Union Mine bathroom with a girlfriend. So.
What do you do at the Union Mine bathroom?
Bathroom? Go to the bathroom and wash my hands.
And that's what you should be doing up there.
Hi, I'm Dr. Goodis, and been watching a lot of things on film today, and I'll just tell you, it really makes me feel bad. When I have to take out a lot of teeth on people. I have a couple of kids of my own, you know, and have a lot of young girls that work for me here, and it's really frustrating. We try to help them all. Sometimes there's just nothing we can do, and we lose a lot of teeth. So don't get involved with drugs. Stay away from them. Stay away from crystal meth. Stay away from everything that you can stay away from. Have a good time. Enjoy your life. But don't end up in my dental chair if you can avoid it.
I mean, I wish I would have known the overall outcome when I first started, or I would have never known.
Okay, let me show you some of the things on your x-rays that you'll be able to see, okay?
All right.
Come on over this way. Okay, if you take a look over here, you'll see that this tooth has a huge cavity in it. So it's obviously been neglected for a long time. And this is one of the ones that's going to need a root canal. And then we'll come over to the other side, and you see there's cavities between your front teeth up here. And once again, there's a large carious restoration there. And this is going to need a root canal. And this tooth is also probably going to need a root canal. So you may need up to 3 root canals. How old are you now?
I'm 22.
So in 22 short years, Most of these teeth have only been in your mouth since you've been about age 13. We've managed to do a lot of destruction there.
Yeah.
So if you had to say anything to the kids up at Union Mine and El Dorado and Ponderosa, what would you say to them?
Say the best thing you do is not ever do this drug, ever.
Hi, my name is Dr. Tan, and just wanted to let you know that the last patient we just saw is one of the many patients we see that's used crystal meth, and you can see the destruction that it can do to our teeth. So make sure you just watch out what's going on here so that we can avoid.
Don't let it be you.
Don't let it be you.
And one of the major impacts that it's had is on my teeth. I've lost almost all of my bottom teeth and back, and I'm about to lose some more, and I've had a lot of root canals. I'm about to have 4 more. It is so not worth what it does to your body and what it does to your dentals. I mean, it just has no, there's no words that I can say that would emphasize enough what it does to you and what it does to your body. Methamphetamine kills and destroys your teeth, your bones. It destroys everything.
Hi, Erica.
Hi.
So what brings you here to the dentist today?
Abscess tooth.
How did that happen?
Partying.
Really? What? How old are you now?
30.
When did you start partying?
14.
What was your drug of choice?
Meth.
You started at age 14. What made you take your first hit?
Peer pressure.
Peer pressure. Now, how many teeth do you think are in trouble in your mouth right now?
More than half of them, probably.
More than half of them. Let's go look at some of the x-rays. Come on over with me, okay? Okay, so you can see up here, if you look very closely, your upper first bicuspid is pretty much broken off and had a root canal done. So that means you've been to a couple of dentists. And this is your upper left side, Erica, and you can see, once again, your upper left first bicuspid here is pretty broken off, and your second bicuspid, and here's what's left of your first molar right here. It's pretty much gone. This is your second molar. And you can see that those teeth have pretty much gone down to the roots, and if you look closely over here, you can also see what's left of your third molar. Just a couple of root tips, they pretty much decayed down. But the real reason you're in here today, if you look very closely, the real reason you're in here today is because this lower third molar has pretty much been eaten away, and it's decayed pretty much out. There's not a whole lot left of it, is there? No. Well, let's look over at the other side. If you look down here at the lower right side, you can see that your first molar and your third molar are both in dire straits, and they both need to be extracted. And your second molar.
One? Yeah.
Well, from here, it looks like it just has a little cavity on the back.
Okay.
We'll probably be able to hold on to that.
Really?
Okay. Yeah.
Good.
So it's nice we're going to have something that you can have a basis for chewing. Yeah. When you were in high school, okay, did you think your behavior changed once you started using it? What happened to your behavior?
I didn't want to be at school.
You didn't?
I didn't care.
How did your grades change?
They just went down.
They went down? What made you start taking amphetamines in the first place?
Just friends I was hanging out with.
How long would you stay up for at one time?
3 weeks once.
Sometimes you stayed up for 3 weeks
Just
solid?
once, yeah.
And after that, would you crash for a while? How long would you be
3
sleeping?
weeks.
So your memory's okay now, but you have...
But there's things, yeah, that I forget.
Okay. Did you ever get to the point where you were seeing shadows and things that weren't actually there?
Tree people.
All right. Can you tell me about that? Tell me what you would see.
Yeah, just illusion, just illusional, just lack of sleep.
So tell me about one of the illusions. What would you see?
Things move that weren't really moving.
What would be moving?
Trees.
The tree would move?
Trees, cars. You're going to show the world my mouth?
Yeah. Not the whole world, just anybody willing to watch it.
All right.
Okay?
Well, if it helps.
Is that all right with you?
If it helps, yes.
It will. We're trying to save kids from going through this because they need to know what they're in for.
This is what, 15 years of...
It's horrible.
How many years did you use methamphetamine for?
Seriously? 15?
15?
About 15.
What made you stop? Or did you stop?
I mean, yeah, I party once in a while, but...
So you still use it?
Once in a while.
On occasion. How much is methamphetamine costing now?
$25 a quarter gram. Methamphetamine is a hard drug to quit. People just can't quit on their own. Once you get too into it, it's an everyday, daily thing.
And we can see back here looking up a couple molars, okay, but here's the tooth she had a root canal on, and now what's left is a tiny little stump. Come around to the other side. Here's the first bicuspid, and second bicuspid's pretty gone. And the first molar, you can see it leaning up against the second molar, just a little piece of the root left. The third molar is pretty much gone behind there. And if we look down the bottom, you can see that her lower third molar is pretty much broken off. On the other side, we can see the lower first molar is pretty much down to fragments of roots, and the same with the lower third molar. We're down to little pieces of roots, and that's all that's left of it. Very hard to visualize down there. So you really managed in 30 short years to impact some really good destruction on your mouth. And we're going to get out a couple of those teeth for you, okay?
Thank you.
So what are we up to, Erica?
Removing teeth.
We're going to lose some teeth.
Yeah.
And mostly because of?
Drugs.
And you used them for how many years?
15.
Okay, there's our first molar. Oh, listen to. Yeah. Yeah, what's left of it? And here's the bicuspid. And this had a root canal there. You okay? Good. You sure?
Since the time they won't turn back for you.
We'll try to get the root canal on the dumb line.
The water slowly wash away. And we both know this time can't pass much slower.
There we go.
And my eyes will roll past your absence. My ears can block out what's never said on my tongue. There's a mutiny, yes, my tongue. It's got something to say. But thanks for all the time you never spent with me. I hope you know it's made me who I've come to be. I'll always remember the times that we've never seemed to have. But in the end we both know this boy, he's getting older. Tick and tock. But the sense of time they won't turn back for you. The clouds will slowly float away, and we both know they can't hold back much longer. Yeah, my eyes will roll past your absence. My ears can block out what's never said, but my tongue, there's a mutiny, yes, my tongue, it's got something to say. Thanks for all the time you never spent with me. I hope you know it's made me who I've come to be. I'll always remember the times we never seemed to have, but in the end we both know this boy, he's getting older. Thanks for all the time.
Voy a poner estas gasas en el área donde fueron las extracciones. No, open. Open. Don't bite. Okay, now bite. Okay, good.
Okay.
Hi, my name is Stephanie Hui Hui. I started doing methamphetamine when I was 15 years old. I'm here to have 3 teeth extracted. I have absolutely no chewing teeth left in the back because of using crystal meth. I have 4 children, and it's something that they never, ever, ever want to do. I've taught them this is what you don't want to do. I live in Placerville, and I just want to get my teeth, what's left of them, fixed. Don't do drugs. Just don't.
You're not even 40 years old.
No, I'm 39 years old.
And you're going to lose just about the rest of your back teeth. How do you
Yes.
feel about that?
It makes me very sad. It makes me extremely sad. I was very proud of my teeth, and using crank has completely ruined my mouth and my health. So that's how I feel about it.
This is your upper right first molar, okay? And you can see the back half of it out here is all missing. That's right over here. That's missing. And then over on this one, this is your upper left first molar, I think. You already lost your bicuspid, right? And the one in front of that has a big cavity in it too. And that's going to probably need a root canal or to be extracted. And you can see that's got a big hole in it underneath this filling. There's the hole right there.
Hi, I'm Dr. Goodis again, and I just want to let you know, a lot of these people that we've seen on this film are from some of the local high schools. And I don't want you to picture this as these 2 high schools are the only 2 high schools in the whole United States having a problem. I think this is a problem that I would call epidemic. What you're seeing here is a snapshot. If I had my office in San Francisco, all the kids would be from 2 high schools that are in the area surrounding my office. So when you look at this, I just want you to realize this is a problem that just doesn't reach to Ponderosa and Union Mine and El Dorado High School and Ponderosa High School. It's everywhere. And it's something that we as parents and we as doctors have to realize and think about. So I want you to watch this movie and think, okay, hey, maybe I shouldn't do these drugs. Maybe these things are bad for me. And if this movie keeps one kid, just one kid, from going on these drugs, then we'll have accomplished our purpose. So once again, don't do drugs. They're not good for you. They don't help you. And where do you end up? You end up here. You end up with holes in your teeth. You end up with cavities. You end up with a lot of problems, okay? Don't let this be you. Don't be the next patient in my chair having teeth pulled out because for 4 years in high school or 4 years after high school, you decide to do crystal meth. And have a nice day. Don't forget to brush and floss. And remember, this is a production of Mitch TV. Have a good day. Bye.
Hola, mi nombre es Marta Pliego y trabajo para la clínica dental de Diamond Springs. Es muy triste ver cómo todos los días llegan pacientes con los dientes destruidos por culpa de las drogas. No usen drogas.
¿Qué vamos a hacer ahora?
Una extracción
¿De qué?
de una muela
¿Y qué pasó con la muela?
está destruida por las drogas.
She wonders why the birds fly by, don't stop in for tea. She wonders why the ghost on the side of her bed shakes his head at me. You know she lives the best she can, but she knows she dies a little more every day. I hate the game she plays like your mother-in-law, but I just can't help but play them. She comes to me and cries, I tell her real lies. You can't find love if love was never there. You can't find love if love was never there. She wants to be a superhero for everyone to see. She wants to do something amazing for everyone but me. You know she lives every day, but she dies a little more every night. I hate the game she plays like your mother-in-law, I just can't help but fight.
Would you like to say anything to the camera?
You can't find love if love was
That's pretty good.
Queremos nosotros que ustedes vean este video, los maestros, para ayudar a los estudiantes a prevenir el uso de las drogas y metanfetamina, y los estudiantes para ayudar a sus otros compañeros y a ellos mismos de prevenir de no usar las drogas o ayudar a otros a tampoco a ir por ese camino malo. Si trabajamos juntos podemos prevenir el uso de las drogas a nuestros hijos. Podemos salvarles sus vidas, su salud y sus dientes. Quiero que vean este video y aprendan. No queremos que vayas por el mal camino y porque la vida es muy corta y queremos que la disfrutes.
Hola, mi nombre es Ernesto García, tengo 19 años y yo he ido a la escuela Charter Community, está aquí a un lado del colegio, y he ido a la escuela Union Mine, aquí está en Diamond Springs, y yo vengo de Lodi, California, está en San Joaquin County, ahí es donde nací yo.
¿Y en qué escuela estás ahora?
Y ahora no estoy en la escuela, estoy trabajando. Y ahora estoy yendo al Independence, para adultos, escuela para adultos, pues.
Para adultos.
Ya soy adulto.
Hola, me llamo Jennifer Silva, trabajo en un consultorio de dentista. Estoy en la escuela Union Mine High School. Me siento mal viendo a mis compañeros o estudiantes de mi edad que ahorita en tiempo vienen a la clínica para que les saquen dientes o les rellenen los dientes por uso de las drogas.
Tenía 3 años que estaba usando drogas cuando estaba en la escuela, la secundaria.
¿De qué grado empezaste a usar drogas?
En el grado 7.
¿Para cuántos años estaba usando drogas?
Unos 3, 4 años empecé a usar drogas y me arrepiento.
Mi nombre es Isabel García, soy asistente dental. Estoy preocupada acerca de las drogas porque es un daño muy grande. Tengo familiares que están usando drogas y me duele mucho que hagan este tipo de cosas porque ellos están destruyendo sus vidas, están destruyendo la vida de sus papás, de sus tíos, de toda la familia. Y es algo que le duele a uno.
¿Estás usando drogas ahorita?
Nada de droga. Como hace unos 2 meses, 3 meses.
3 meses.
Pero drogas malas, o sea, no he hecho yo drogas como en 3 meses.
Cuando te dice qué tipo de drogas tú consideras malas, ¿cuál sería?
Son las metanfetaminas.
¿Por qué piensas que la metanfetamina es mala?
Es mala para uno mismo, te mata adentro, no eres igual, no te puedes comportar igual porque estás bien nervioso y los dientes se te caen, se te quebran pues fácil y no eres la persona que eras.
¿Qué es el futuro? Aquí sería su futuro. Dentaduras completas. Boca llena con caries. Dientes destruidos. Una vida destruida. Esto, yo puedo ver su futuro correctamente. Ella puede ver su futuro correctamente. Queremos para usted a ver su futuro si está usando drogas. Si está usando drogas,
Di no.
¿por qué?
Porque no quieres usar dentaduras a la edad de 25 o 26 años.
No quiere perder su vida. No quiere perder su mente. No quiere perder todo en su vida que tiene valor a usted y tu familia.
Piénsalo 2 veces antes de decir sí. Di no. Tus amigos no te van a dar drogas. Esos no son tus amigos.
Si sus amigos están usando drogas, ellos no saben. They don't know what they're doing.
Ellos no saben lo que están haciendo.
It doesn't have to be this way.
¿Qué cambios tú sentiste cuando empezaste a hacer las drogas?
No sentí nada, me cambió a mí mismo y ni sabía lo que sentía, ni sabía quién era, ni sabía dónde andaba. Pues casi perdí todo por eso. Pues no estaba haciendo las cosas bien, entonces ni me dio energía para ir a la escuela, entonces ni acabé la escuela bien.
Cuando te regañaban en la escuela para ir con tu director, ¿por qué eran las razones?
La razón era porque no iba a la escuela y porque no estaba poniendo atención en las clases.
¿Llamaban a tus papás para avisarles las cosas que tú estabas envolvido?
Le llamaban cada vez y cada vez que le decían, cada vez yo no le ponía atención. Y pues eso es, también me arrepiento pues haciendo eso.
Mi nombre es Amparo López y quiero hablarles acerca de las drogas. Usar drogas es malo para tu salud y tus dientes. Habla con tus hijos acerca de no usar drogas porque es muy dañino para su salud, dañan su cerebro y toda su salud. Hablen con ellos y estén seguros de que ellos no usan drogas. Y niños, no usen drogas.
Cuando te cacharon con las drogas, ¿fuiste a Juvenile Hall?
Fui para unos 4 o 5 meses y luego unos 3 más meses.
¿En cuál grado?
Estaba en el 10, no, en el 9.
¿Y cómo está tu memoria ahorita? ¿Recuerdas muchas cosas o se te olvidan?
A veces sí me acuerdo de las cosas, pero casi no me acuerdo cuando andaba usando la droga, porque cuando lo usaba me mataba pues, ¿cómo se dice? Estaba pues en arriba, no sabía qué es lo que estaba pasando.
¿Cómo te sientes después de usando las drogas? Cuando estás en las drogas, cuando tomas una droga, ¿cómo te sientes?
Pues me siento bien nervioso, me siento diferente en lo que era antes. Y no me gusta cómo ando ahorita porque me he cambiado cómo duermo y cómo respiro y todo. Pero trato de mantenerme yo. Estoy yendo ya ahorita con mi novia acá en the Adult Elderly Independence High School.
Independence High School.
Yeah,
¿Piensas que hay muchas personas en Independence High School que están tomando drogas?
Hay hartas. Casi todos ahí andan usando drogas.
Casi todos. ¿Piensa usted que el director de esta escuela sabe que hay algunos estudiantes en su escuela usando drogas?
Sí saben, ahí saben todos lo que hacen ahí.
Todos.
Sí saben entre pues los niños saben lo que hacen todos y los directores más. También saben, pero nunca cachan que está pasando nada.
No hay
sí se les ve luego a los
¿No hay ningún programa ahí?
No.
¿Para drogas? ¿Para evitar drogas?
Esa escuela es donde mandan los chiquillos que no se portan bien y que no andan haciendo bien en la escuela.
Sí.
Entonces ahí van a estar lo peor. Ahí van a estar lo peor.
¿Pero no tienen programas que puedan ayudar a los estudiantes que están en las drogas para
sí tienen NA, Narcotics Anonymous, tienen
¿En Independence High School?
No, they don't got it there.
No tienen nada de ahí.
Nada, no lo tienen ahí, pero lo tienen en todos los lugares por acá pues.
En la escuela que tú estás atendiendo ahorita, como te has ido y regresado, ¿has notado que hay gente ahí que todavía usan drogas?
Sí, yo he ido y regresado de esa escuela y cuando me fui de esa escuela hace un año, estaba gente usando drogas y estoy seguro que ahí hay gente usando drogas. Y deben de poner atención a quién está usando droga ahí y tratar de ayudarlos antes que pasen la droga a otra gente. Les quiero decir que se fijen en los estudiantes, que se fijen bien en lo que está pasando con ellos y cómo están cambiando. Y si ven que anda pasando algo malo, deben de hacerlo deben de mandarlos a programas luego, y deben de decir a sus papás que los cuiden bien y que le pongan atención a sus hijos. No he completado la escuela por las drogas y las malas amistades.
He estado hablando con Ernie, que es un usador de drogas o era, y es obvio o claro que ya en las escuelas hoy en día es muy fácil de conseguir las drogas y también en toda California. Entonces hay un problema muy grande que necesitamos resolver. Esperemos que ustedes como que están viendo esta película hagan algo por evitar a los estudiantes venir en esta silla y ver los señales y los síntomas antes que para prevenirlos que venir.
If you had to do it over again, what would you do?
No lo hubiera hecho, me hubiera quedado en la escuela y no me juntara pues con la gente que yo me juntaba.
Hi, my name is TV Sai and I graduated from Union Mine High School in 2002 and I work at this fine office, the Diamond Springs Dental Center, and I'm just tired of seeing people coming in and getting their teeth pulled out because they've used too many drugs. So all I want to say is don't do drugs, no usa drogas.
Let's take a look inside your mouth, okay?
Okay.
Okay, so we've got you all retracted, okay? And what we're going to do is just zoom in here on your teeth a little bit. So you can see that these teeth have experienced the ravages of crystal meth. And front tooth is broken off, that's tooth number 9, big cavities. And here's some classic signs of crystal meth use. You can see cervical decay around the teeth, and once it gets into a little weak point, these teeth just sort of melt away. And open up real big, and we're going to look back, lift your head way back, and what you can see is there's a lot of teeth missing back there. And once again, this is a dentist's eye view, and this is all that's left of the mighty first molar. And what's left of the mighty second molar is even less. Your tongue over to the right. There we go. And you can see where it used to be the mighty molar down here. We now have a little bit of stubble left, and once again, not a whole lot left of these teeth.
¿Qué tipo de trabajo tenías cuando te corrieron de las escuelas por las drogas?
Era un basurero y no me gustaba para nada, entonces me salí.
¿Por qué no le gusta este tipo de trabajo?
Porque huele esa basura y pues es trabajo feo.
¿El pago es muy pobre?
El pago es no es pobre, pero no es lo que quieres. Quieres más.
Quiere más de su vida.
Quiero más de mi vida en vez de eso.
Yo pienso que este camino de usar las drogas no es para ellos. Ellos necesitan o esperan algo mejor de sus vidas que usar las drogas y ir por el mal camino. Espero que escogen el camino correcto y no lo hagan porque les va a afectar a ellos cuando sean más grandes.
Tengo unos tíos y unos primos que andan mal, pero para ellos no es mal, porque es su vida. No le pueden decir nada porque ya son adultos y son, ¿cómo se dice? They're functioning drug abusers.
Functioning? How would you say that? Funcionando.
Pues están pagando sus biles y están yendo a trabajar, pero estaban haciendo cosas malas.
Pero tiene usted un hermano que estaba usando drogas, ¿sí?
Y tengo un hermano.
¿Cómo se llama?
Adrián García.
¿Y dónde está ahora?
Y ahorita está en la cárcel y lo van a mandar para la prisión para 1 año y medio.
Y dime por favor, ¿cuántos años tiene su hermano?
22. Tiene 22 años.
Y va a pasar ahora 1 año y medio en cárcel.
1 año y medio o 2 años en la
por usar
prisión.
drogas.
Por usando drogas. Por la droga.
¿Cuál droga?
La metafetamina. La metafetamina.
Me duele mucho ver que muchos de los estudiantes de mi edad tengan que sentar en esta silla para que les saquen los dientes por uso de drogas. Espero que los directores y los maestros de las escuelas hagan algo para eso, para evitar que los estudiantes vengan a sentarse en esta silla, para que le quiten todos los dientes.
Mi nombre es Marina y yo tengo 2 niños y estoy muy preocupada porque actualmente todos los niños muy chicos consumen drogas y lo que yo quiero que mis hijos cuando estén grandes tratar de que ellos no consuman drogas porque es muy malo para su salud.
So the thing is, don't do
No
drugs.
hagan drogas.
Okay. Okay, so we're just looking in here. We're going to use the retractors in a minute, but what you can see here is basically we've lost a lot of tooth structure back here. And we'll look at that in just a minute. Bite down again and smile. Okay. Okay, so here we are looking at your front teeth, and we can see that there's been a lot of destruction over the years. This is a classic pattern in crystal meth use. We start losing a lot of back teeth. Okay, open up real big. And there's a complete destruction going on here. You have nothing left but roots if you look in the bottom. And on the back on this side, it's the same thing. Turn your head to the left a little bit. Okay, and now turn to the right. And what you can see is, you can see the complete destruction that goes on with the facial enamel, and then it progresses and eats away the rest of the tooth. Eventually the tooth is lost, just as a weakening of the enamel structure. It's very difficult to overcome. Estas radiografías son las radiografías de un paciente que estaba usando metafetamina para 4 años.
Ella fue en su vida a 15 diferentes dentistas y ninguno le preguntó cuál es la causa de este gran problema.
Mira, es muy fácil a ver que recibió ella empastes aquí, endodoncia aquí, coronas aquí, otra corona aquí, otro empaste aquí, endodoncia aquí, otra endodoncia aquí. Estos servicios cuestan mucho.
Y nos están costando a todos. Tenemos que tener en cuenta todo este tipo de problemas y preguntar por qué, para poder saber cómo resolver este tipo de problemas con pacientes que usan drogas.
¿Qué vamos a hacer? Dentistas necesitan que saber las preguntas a preguntar los pacientes. Pacientes necesitan que decir a los dentistas, sí, yo estoy usando metanfetaminas, y ellos van a saber qué es necesario hacer, ayudarte. Pero no hay razón a hacer una corona cuando tiene una boca llena con destrucción. Esto,
como por ejemplo aquí vemos abscesos, caries muy profundas, endodoncias, coronas. Este es el gran problema que tenemos con pacientes que usan la metafetamina. Por eso pedimos a todos los dentistas que hagan estas preguntas a los pacientes. ¿Qué es el problema con ustedes para poder ayudarles a resolverlo?
algunos pacientes dicen, oh, estoy tomando mucho Pepsi Cola, mucho Coca-Cola, mucho soda, estoy comiendo limón, estoy no sé qué, pero el razón verdadero es que, oh, estoy usando metafetaminas y por esa razón estoy tomando limón, estoy bebiendo Coca-Cola todo el día, día por día por día. Y por esa razón, la resulta es que puede ver aquí destrucción completamente de estos dientes. Y ya es necesario sacar todos los dientes y darle dentaduras.
Si tú estás usando metanfetaminas y piensas que esto no te va a pasar a ti, piénsalo 2 veces. Esta persona pensó lo mismo y ve que terminó. Esos son los daños visibles que hace la droga. Imagínate lo que está haciendo en tu cuerpo, adentro de tu cuerpo. ¿Qué es lo que está pasando con tu cerebro? ¿Qué tanta destrucción hay en tu cerebro? Si tú eres un padre de familia y tienes hijos adolescentes, pregúntales con quién están. Habla con sus amigos, sé parte de su vida, no nada más los dejes a ellos solos. Habla con ellos, con sus amigos, conócelos.
You know why I'm doing this? Because my grandchildren have to go to these schools, okay? And I want them to know about this stuff and not to get involved. Okay. So we got this one there. This is better than going fishing. Great. Venga, papá.
Aquí se puede ver el resultado del uso de anfetamina.
Hay mucha destrucción aquí. Maxillary lateral incisor. Centrals. If you look at them really closely, they're greenish gray. Watch. This is interesting. Watch this. Ready? Watch. These teeth are incredibly weak. There's nothing left to the structure.
Ella empezó a usar drogas cuando estaba en el grado 11 y terminó de usarlas cuando estaba en el colegio.
Estaba usando drogas para solamente 4 años. Y ya podremos ver los resultados.
El esmalte de estos dientes por enfrente está muy débil y puede ver que es muy fácil quebrar el diente. Solamente usó 4 años drogas y ahora 20 años después puede ver los resultados. Ahora está sufriendo. Si estás pensando en usar esta droga, metafetamina, y piensas que no te va a causar problemas, piénsalo, porque en el futuro vas a tener problemas, vas a destruir tu cerebro, todos tus dientes.
Es un problema peligroso. Es un problema que tenemos en todas las escuelas en los Estados Unidos.
Esta clase de drogas lo estamos teniendo en todas las escuelas de Estados Unidos.
Si eres una maestra, if you're a teacher, talk to your students about it. If you're a student, don't ever start.
Si tú eres un estudiante y tienes amigos que están usando esta clase de drogas, anfetamina,
dile a ellos, no usa estas drogas, que va a perder sus dientes.
dile a ellos que no usen estas drogas porque van a perder sus dientes. El año pasado el distrito escolar estuvo haciendo una observación. 1% de los estudiantes del grado 9 y 1% de los estudiantes del grado 11 dijeron que estaban haciendo esta clase de drogas en los 30 días pasados.
Sí, 75 mil.
75 niños tenían otra clase de enfermedad como viruela, meningitis, y el Departamento de Salud estaba tratando de resolver este problema, pero este es un problema de drogas y nadie está aquí para ayudar a estas personas con este problema de drogas.
Ellos son nuestros niños.
No es un problema nada más en la escuela secundaria de Union Mile ni El Dorado High School, sino que es un problema en todas las escuelas secundarias de Estados Unidos. Si tú eres una maestra, un dentista o un estudiante,
Escucha esto. No usa esta droga.
no uses esta droga. Estoy preocupado porque estaba hablando con un director de una escuela secundaria y él me dijo, no te preocupes porque estos niños que usan esta droga de methamphetamina no regresan a la escuela, no es un problema. Y entonces yo le dije a él, claro que es un problema, este es el problema porque nuestros niños no regresan a clases. Ellos están perdiendo la escuela, están muriendo en parques, están durmiendo en la calle.
Y no está bien, porque
Estas personas son nuestros niños.
Ellos están destruyendo su cerebro. Tenemos que ayudarlos. Dr. Goodies es abuelo de dos hermosas niñas y a él le gustaría que cuando sus nietas estuvieran en la escuela secundaria ellas tuvieran toda la información acerca de drogas. Si tú eres un niño, una maestra, un papá, si ustedes tienen niños o no tienen y están viendo este video, díganle a ellos qué es lo que están viendo. Denles información y díganles que nunca tienen que empezar a usar drogas.
Niños no usan drogas.
Niños no usen drogas.
I just said that.
Pero más fuerte.
Yeah, okay.